Welcome to the Northeast Kingdom Voice. I'm your host, Scott Wheeler. Today's guest is Dr. Don Harris, a chiropractor. Welcome to the show, Dr. Harris.
Thank you.
So, you're a chiropractor, is that correct?
My original training is in chiropractic, yeah. I actually went to Chicago, did 4 years of my chiropractic experience, but I also do a lot of clinical nutrition. I have 2,000 postdoctoral hours in clinical nutrition. So right now I would say probably 70% of my practice is clinical nutrition, and about 35% is chiropractic. So a little bit of both.
So first of all, I have never been to a chiropractor.
Mm-hmm.
What is
you haven't?
No, I
Really?
haven't. Actually, I've lived such a blessed life. When I was a kid,
Yeah.
I was like the canary in the mine. If there was something going around, I would always get it. Chicken pox, mumps,
Mm-hmm.
but I got it out of my system. I have never spent a night in the hospital as a sick person.
Wow.
Nothing.
So, you're not the norm.
No, well,
So.
if you know me, and most people will agree with that, I'm not the norm. So what is it?
In a good way. You're not the
Right.
norm. Chiropractic is a form of a physician. There are different types of physicians in the U.S. There's obviously MDs, medical practitioners. There's DOs, doctors of osteopathic medicine, and there's chiropractors, doctors of chiropractic. Chiropractors tend to treat more musculoskeletal issues. So if you have neck problems, back problems, low, mid-back problems, that can manifest themselves in headaches, sciatica, leg pain, knee pain, joint pain. So by addressing the spine, by addressing the joints, we can actually work with soft tissue in the musculoskeletal system by actually adjusting them, getting back into alignment, taking pressure off the nerve roots, and then hopefully the muscle spasm and the pain and inflammation goes away. So that's typically what a chiropractor does.
Has it become more mainstream now? Because it seems like
Totally.
Because it wasn't too many years ago that you were kind of like viewed as out there a little bit.
I had some come in yesterday and said they still refer to the term voodoo.
Right. Actually, I was going to use that word.
It's like voodoo medicine. I guess I would have to say if most insurance companies, even Medicaid, Medicare, Blue Cross, all the major insurance companies are now paying for chiropractic coverage, if it's not effective, they're not going to pay for it.
Right.
And virtually every single scientific research article that's come out in the last 25 years has showed the effectiveness of chiropractic.
Right. Actually, I was on the healthcare committee in the Vermont State House when we made that, so you will get paid.
Which is nice. Thank
right?
you. Thank you.
But the thing is, that's where I did actually learn some bits and pieces of chiropractic medicine is just through all the testimony we took.
Mm-hmm.
But so if I get sick or if I hurt myself, I might be able to experience it.
It's interesting because being from the city, originally I was born in Boston, did my undergraduate in Boston, then I did a master's in Boston. I moved out to Chicago to do my doctorate. In Chicago, it's a little bit interesting because if you wake up with sniffles in the morning, you're at the doctor that afternoon. All right. Here, it's amazing the people who come in, and they'll tell me stories. They'll show me the scars of chainsaws and the fingers that have been almost have fallen off. They've cut them off, and the people up in the Northeast Kingdom just don't go to doctors a lot. It's just something that they just don't like to do, and. But for whatever reason, they like to go to chiropractors. I guess it's a little bit more alternative. So it's a whole different aspect in terms of like an urban life in terms of medicine and chiropractic as compared to a rural life where people tend to utilize chiropractic a lot more. Now, my practice is a little bit different in terms of the chiropractic part of it. A lot of chiropractors will do a great job, and I think that Newport is blessed to have a lot of good, high-quality chiropractic physicians here.
Mm-hmm.
I tend to do things a little differently. I tend to spend about an hour with my patients.
Mm-hmm.
To me, if you don't look at the soft tissue surrounding the joints, the ligaments, the muscles, the tendons, the interstitial tissue, you can adjust all you want. And if you don't kind of work that, the adjustment is going to be a lot harder, and it's not going to stay as long, okay? So the average office visit in my practice is about an hour, whereas a more of a typical chiropractor is about 15 minutes. And I'm not saying anything against them. I mean, that's what works for them.
Right.
15 minutes, and a lot of people just want to come in, get their adjustment, 15 minutes out the door. My practice, again, is a little bit different, where I tend to work more of the whole body,
Right.
like I said, in stretching, soft tissue, myofascial. And when you do that, you prepare for the adjustment a lot easier, and adjustment holds a lot better.
Right.
So I have a little bit of a different approach.
Right. So what brought you to the Northeast Kingdom?
Again, I was born in Boston and
Right.
did my undergraduate work and my master's in Boston, and went out to Chicago and did my doctorate. I had never any intention on staying in Chicago. Just I was like going to Chicago, doing my 5 years of doctorate in Chicago, and I was gone. Met someone in Chicago, ended up staying in Chicago. But when I was an undergrad, my parents moved to Craftsbury 30 plus years ago, and I had a sister and her husband moved to the Albany area. So after 30 years of practicing in Chicago, living in an urban environment, I felt that I was very lucky that my parents were healthy in their 80s, and I'm in my 50s, so I was very fortunate to still have my parents alive. So I figured, I want to spend some quality time with my parents. So I gave up everything in Chicago to come back to Vermont to spend time with my family, and it was the best decision that I've ever made.
How have you weathered of course, Chicago gets pretty cold.
It doesn't get to 30
days.
below, but what Chicago has is that it has a wind coming off the lake that is just brutal.
Right.
And that wind is just cold, damp, raw, and it goes right through you.
Right.
So, yeah, it is not quite, the 30 below in amount of snow that you get here, but it's still cold.
Right. One thing I think maybe people like about chiropractic medicine too is the same reason I like to go to my doctor, and I think he walks on water, Dr. Robert Wood of Derby, is they're not owned, but no disrespect to the good doctors who are owned by the hospital, but I feel that I want to go to a doctor who is independent, who can make their own, I want them to be able, to go into the hospital, but I don't want them to be owned. And maybe that's what you're seeing too, because I don't know if you've noticed, we're kind of an independent lot for good and bad.
Yeah, I never noticed that.
No. But you were talking about the loggers with chainsaw cuts, and I know I have a relative who more than once got a cut or knife blade, skinning something, and out comes the fish line or thread.
Absolutely, yeah.
And sew them,
Sure.
Sew themselves up. Meanwhile, the reason I don't get hurt is I'm a wimp. So I just try to steer clear of injuries.
But I would probably disagree with that in terms of you're a wimp. I'm sure you've hurt yourself and you're taking care of yourself. It's just a mindset up here that you just don't turn to the emergency room or an MD as your first choice, and you tend to kind of take it as it is on the with the agricultural community up here on the farm, and you just deal with it. I just had a woman come in yesterday and said that her mother used to stitch her up every time she got a cut when she was a child. Again, would never happen in the city. So it's definitely been a little bit of a learning curve in terms of trying to work with the population in an urban environment.
Right.
Like I said earlier, who if they wake up with sniffles in the morning, they're at the doctor's that afternoon. And here it takes someone almost dragging and screaming to go to the emergency room. But I kind of like that approach better because people tend to be more aware of what their situation is. They tend to be more aware of their health. They take better care of themselves. They're not turning to a very expensive procedure or test or imaging procedures that that just raises the cost of healthcare in this country, and they're taking care of it on themselves. So I actually prefer this type of thinking rather than an urban environment where people are utilizing doctors and hospitals and very high cost imaging at the drop of a dime.
Right.
So
I'd be willing to bet you though is I know we have a mutual acquaintance, Dr. Les Lockridge, who's an oncologist, and I bet you he would probably tell you though the downside of our fierce stubbornness is sometimes I believe that we're almost dead by the time we get to a doctor, as in like stage 4 cancer, before we finally say, okay, time to go, which maybe that's a good thing. I don't know, if it's going to be a terminal, case, but I have to believe sometimes we also hurt ourselves.
I would agree that there's definitely, if you catch something early on, your chances of survival are much better. So yes, there's the good part about it, and there's the bad part about it. And of course, waiting too long and not getting to a doctor in an appropriate amount of time can have negative consequences too. And you're right, Les and I are good friends, and he is one of the few MDs in the area that think outside of the box a little bit, and he sends me a lot of his cancer patients for the nutrition part of the practice. And again, when people are going through chemo, they're going through radiation, they're going through all the different side effects that are going on. Nutrition can have a tremendous benefit, not in terms of symptomatic relief, but working in adjunct with the chemo and the radiation to help them. Matter of fact, and I don't think anyone would have a problem. I know I've talked to the family many times about using her as a example. And the McClure family, I know if you know Ellen or Dan, and Ellen was my first patient when I came to Vermont. Unbelievable woman, unbelievable lady, and the family is just amazing. And we were working with her to try to maintain protein levels and make sure she wasn't losing muscle tissues, and make sure she was maintaining her energy levels, possibly some supplements to help with the effects or to assist with the effects of chemo and radiation. Now, unfortunately, she passed away.
Right.
But at least she had a better quality of life for those 4 or 5 months that she had before she passed away. So again, we talked about the name of my practice, Harris Integrative Health and Nutrition, and I'm a huge believer in integrative health care. Right. You have to take the best of all healthcare, whether it's traditional ND, acupuncture, massage therapy, personal training, physical therapy, acupuncture, chiropractic, energy work. There's so much out there that can actually help a person in terms of nutrition or any other way. And so one of my goals is actually to really work with the medical community here and try to really instill the idea of integrative healthcare, and not just one doctor taking full responsibility and not really kind of reaching out to other alternative healthcare professionals who can actually have a benefit with what they're doing. It's a little bit tough. When I first moved here, I actually wrote an editorial in the newspaper that I just didn't feel that the community as a whole, the health community as a whole, was utilizing the alternative healthcare as they should be or could be. Right. And to the credit of a lot of the healthcare practitioners, mostly MDs in this community, they have actually done a very good job in terms of trying to more integrate healthcare into the Northeast Kingdom. And I think it's only going to benefit, number one, the patients, but it's also going to help the healthcare costs in this area by bringing the healthcare costs down. So
how does chiropractic medicine and your nutrition aspect of it help keep the costs down?
Well, let's just say someone comes in with low back pain and sciatica, all right? And let's just say their first choice is going to an MD. And then MD will say, okay, well, we may need a CAT scan, or we may need an MRI, or we may need some anti-inflammatories, or prednisone, or painkillers. And you know how much these tests cost, and you know how much these pharmaceuticals cost. I mean, it can drive up the cost of healthcare dramatically in a very short period of time. A chiropractor can get in there and look at it and say, okay, it's the sciatica is caused by a dysfunction in what's called the SI joint, which has maybe locked up, putting some inflammation on one of the nerve roots. And by a couple of series of adjustments, by loosening them up and stretching the surrounding tissue out, we can get rid of the sciatica in a couple of visits without the CT scan, without the pharmaceuticals, without all the high costs, the high-end costs of healthcare. Now, that's not to say that happens every single time. Sometimes I do have to refer out to a CT scan or an MRI if they're not responding the way that they should be. But if you can start with a less expensive but just as qualified technique to get someone better, faster, without that extra $3,000, $4,000, $5,000 in imaging and pharmaceuticals, you multiply that over millions of people in the course of a year, it's obviously going to have a dramatic effect on healthcare costs.
Well, you take my wife, and I wouldn't doubt if eventually she ends up at your doorstep. Back several years ago, she was rammed from behind.
So a motor vehicle accident? Yeah.
And it totaled the person's car in front of well, totaled the other person's car, and it took our truck and even bent the frame.
Wow.
And she was out of work for a long time, but it's one of those, a lot of people laugh about whiplash. Let's be real. Some people do use the word whiplash to see if they can get any money. Well,
without a doubt.
She has suffered. She finally went to a local doctor who's an anesthesiologist, but he also dabbles in acupuncture. Dr. Greg Walker, who I went to school with.
I've heard of him.
And my wife went into that not believing a bit of it, but she was so desperate to get rid of her migraines when nothing else would work. And so I don't think it was mind over matter, because she didn't believe it was going to work. And those little needles,
it worked.
It worked. And the thing is she still has ramifications of that accident, that maybe with a little twist here and a little twist there. But she, I don't know how much money went into her expenses, and
without a doubt.
And it's, she's probably like 75% back to normal, but still she has her
100%.
No, she still gets her migraines. But so who might go? So what kind of injuries might show up? Like if you have a broken arm, you're not going to go to the chiropractor.
No, absolutely not. I mean, like I said, I tend to be more integrative, and I'll be the first to recommend or refer someone to. I had a woman in the office a couple of weeks ago, and she literally was coming in, and she was on the floor crying in so much pain. The inflammation, the swelling, she was just in intense pain. I couldn't even touch her. I said, you need to go to the emergency room. We need to either get some type of imaging, or you need some type of anti-inflammatory or painkiller. So there are obviously things that I will not touch.
Right.
And I would be the first one to refer them out to the appropriate healthcare provider. Whether it's the emergency room, I'm always referring people back up there for, like I said, either imaging or, get in there right now if they can't get into their primary physician, or sending them to their primary physician if they need some type of, again, anti-inflammatory or a painkiller. So, sure, I mean, any type of a fracture or broken arm or traumatic injury, a chiropractor is not the one that you want to go to. You need to get them to the appropriate medical healthcare provider initially.
Right.
Once they do that and they find out whether it's a fracture or not a fracture, maybe it's a ligament issue or a tendon issue. That's something that could be a soft tissue issue, and they come to me, and I'll evaluate them and I'll treat them. My philosophy is, if I can't get someone 50% better in 3 visits, I won't see them again.
Right.
All right. I'm not one of these people that have you come back. At that point, if we're just not getting them any better, then I would refer possibly to a massage therapist or a physical therapist. And there are some great massage therapists. For Newport, the size of it is, being small. And I think it's funny because people refer to Craftsbury as, way out in the boonies.
Right.
And coming from Chicago, where there's like 6 million people, Newport isn't like, to me, the metropolis. And I always refer to Craftsbury as this, tiny little community way out in the country. But for Newport, as small as it is, the quality of healthcare in this community is fantastic. Not only from the MDs down to the massage therapists are phenomenal in this community. The physical therapists are fantastic. Acupuncturists, chiropractors. There's a whole gambit of people to refer to. And so for people who aren't utilizing the talents in this healthcare community in this small town of area of Newport, are doing the patients a disservice.
Now, how about because it's well known the Northeast Kingdom and Orleans County, we're losing a lot of healthcare providers.
Right.
And that's a series of factors, including I suppose if you stayed in Chicago, your income would probably be quite a bit higher. Mm-hmm. So you have to sacrifice. Do you help fill the void of this outflow of doctors at all?
I hope so, because again, if someone, a gentleman came in the other day with low back pain, and I evaluated him and I worked on him twice, and I realized, okay, this is something that's not getting to the point where we want to, that I want to treat. I think it's something that we need to kind of see what's going on. So I did refer him to an X-ray, and the X-ray came back with some degeneration throughout the low spine. And I was honest with him. I said, you can go back to your primary. She's not going to be able to do anything. You can come back to me. I'm not going to be able to do anything for what this particular set of issues that the X-ray showed. And I referred him to a personal trainer. Right. I think that would be the more appropriate course of action for him, based on the findings of the X-ray. So would a personal trainer, 2 to 3 visits of a personal trainer to start building up his core, to strengthen up the core muscles and the back muscles, which would have a lot better effect in long-term and healthcare for him, other than continuing to go to an MD and continuing to go to get these drugs and everything? Sure. I mean, we probably save 90%. I mean, it would, $300-400 as compared to probably $3,000-4,000. So
now it seems to me, though, in the last few years we're starting, because it weren't too many years ago that doctors worked independently of, not just here but anywhere. They worked independently of hospitals. Mm-hmm. But over the years, just our country has gone to the model where the hospitals typically own the doctor's practices. But it seems to me now that there's more people who are starting to break away a bit, like Dr. Lockridge.
Like Les, absolutely.
He has an outstanding service. He provides oncology service,
internal medicine.
Right, it's internal.
With CAT, he does behavioral.
Right, And do you think we can actually go back to that a bit? People like you, or do you think that this
in terms of people getting away from the hospital?
Yeah, not so much about it's nothing about the hospital, but I think people feel comfortable knowing that their doctor is there for them, and that they're not there, because I think you believe in spending a lot of time with your patients if you need it.
Absolutely. Like I said, my average office visit is an hour.
Right.
And that's just kind of unheard of. With most visits are anywhere between 15 minutes and maybe 25 minutes. And again, I'm not discouraging anyone else in terms of the profession. They have the way that they feel comfortable in practicing. I just like to spend an hour with my patients, getting to know them, doing all the different things that need to be done. I'm not 25 years old. I'm not out there trying to, break any records. I, kind of like want a little bit more of a laid-back practice and get to know my patients a little bit more. But as far as being independent, yeah, I think it's nice to have a little bit more choice in what the treatment is, instead of being pressured from someone else to say, okay, we need to do this because our bottom line is we need to have more imaging.
Right.
We need to have more ultrasound. We need to have more X, Y, and Z. And if the MD or whatever doesn't want to order that, and they have that right to, instead of having some pressure from someone else in terms of, hey, okay, we need 15 more MRIs, in the course of the week. Not to say that an MRI is a bad imaging test. We definitely need them. But sometimes we don't need them, and I think they get a little bit of pressure to kind of, look at the bottom line a little bit more. Now, I'm a little bit different because chiropractors are not allowed to have any hospital privileges.
Right.
All right, which drives me insane. Now, thank God North Country allows me to send all of my referrals for x-rays and CAT scans and CT scans and blood work up to them, and they do a great job. As a matter of fact, I don't want to have an x-ray in my office. I'm not a radiologist. Mm-hmm. I don't have the time. To me, it's just easier to send a requisition up, go get the x-ray. If I need to see it, I'll get the report from an expert, the radiologist, and I can sit down with my patient and say, okay, this is what we need to do. If it's something that I feel that I cannot handle, based on, like, maybe it's stenosis, which is kind of closing of the spinal canal, wrapping around the spinal cord, I'll refer them out to a neurosurgeon. But yeah, it's nice to kind of have a little bit of an independent practice where I can make my decisions a little more independently of someone else. Now, with that being said, I'm still liable to the insurance companies, to make the right choices, and I'm still obviously liable to my patients to give them the best quality health care that I possibly can. And so even though you have to look at the bottom line, the bottom line is the overall healthcare, quality of healthcare for the patients.
I think you'll enjoy a series that I'm working on this summer for my journal. Is I've started interviewing some of the old time doctors, like Dr. Frank Amanti, who's 94.
I think you sent me the ad on that. Or something
in
that's
90,
coming up. Yeah,
he's 94. He lives but he talks. He lives in Florida now, but he talks about the days where one time he had to go from Derby, go to Holland, and got to a certain point where they had to pick him up with a horse and buggy because the road was too muddy.
Yep.
And he said that that earned him $15 to deliver a baby. And he said if you wanted to go to the hospital, it was $5, and he would deliver it at the hospital. But he talked about because back then he was with him he used to do surgeries, he used to deliver babies, and he kind of hated to see, even though I think this technology is great, and I don't want to have to go back, but he did think that with the evolution of medicine, some of it was lost, some of the goodness was lost, though, because he feels that a lot of medicine is listening. And so that even though he appreciates all the technology, he thinks that a good doctor truly has to listen and not be so absorbed in all their new technology that they're typing on and everything.
Absolutely. Any good professor at a medical school or other school will tell you that if you listen to your patients, they'll tell you 90% of what you need to know.
Yeah.
All right, and I totally agree with that. The problem is in our society, which is a litigious society, there's called standard care, and I may know someone may come in and I'll listen to them and we'll sit and we'll talk and we'll do everything, and I have a pretty good idea of what's going on, but you're always in the back of your mind thinking, okay, is there something else I should be doing to, let's just face it, excuse my language, but to cover my butt. And so many doctors and so many hospitals and so many people in healthcare order tests, and they do things that probably aren't necessary, because if something happens, they're going to get sued, and then they can at least fall back on this and say, hey, I ordered these tests, so I'm not liable. So there's kind of a battle there between, do you really need these tests? If you listen, probably not all of them. But then the other side of it is, what if you don't do this test and something happens, and then you're going to get a malpractice suit?
I have twins, and they're 29 years old, but when they were in college, somebody said, I heard one's going to be a doctor. I said, oh, no, I hope not. And because that was my first response, because you guys, and doctors as a whole, they have to hold people's lives in their hands. I don't, like as a writer, if I make a mistake, I can put a correction in the next issue. Or one doctor, I don't know if you've met him yet, he's retired now, Dr. James Moss. He was our long-term orthopedic surgeon. He was here for years. And when I interviewed him, he was thrilled about getting done. One of the things he did, he was one of my boys, I think volunteer ski coaches. Here's this dour, very serious man. He gave himself a multicolored mohawk.
Multicolored.
Because he had never been able to do that. Well, so here's where it goes: is he is now one of the world's best bird carvers. If I put a bird down here that he made, you would swear it was real. And he said it was because of working on the joints and everything, fine details. And the way this comes about is, he said, it's so much more relaxing. He says, working somebody's joint, if I make a mistake, I'm in trouble.
Right.
If I make a mistake on that bird, goes in the fire and it heats me. So that's what he did with his skills.
Yeah, it's a little bit of a different concept, obviously. And again, that you do have to be aware of what's out there and what's coming. But it shouldn't be the driving force as far as people who are still practicing. I mean, yes, you have to keep that in the back of your mind. But still, obviously, the number one concern for any healthcare provider has to be, the highest quality of care for their patients. And again, as far as the other part of my practice in terms of the nutrition, it's fascinating, again, what you can do with certain illnesses, anything from, like I said, Dr. Lockridge, some of the cancer patients, heart disease, diabetes, autoimmune illnesses, these are all skyrocketing in this country. And to say that there was an article that came out that we don't know, it's kind of like it's luck of the draw, and I completely disagree with that. With that.
What do you mean luck of the draw?
There was an article that came out that actually if you got cancer, you just had the luck of the draw, the bad genes. There's really nothing that actually led to that, and I can't disagree with that most. I mean, I can't disagree with that more than what I can disagree with it. We live in a toxic environment where at any given time 242 toxins are in our body. All right, more than half of those are carcinogenic. All right, we live in an area of a time where we have high inflammatory markers in our body, and I don't mean inflammation like a little redness on the skin. I mean very destructive inflammatory markers that are causing lots of problems, that are affecting our immune system, that are causing cancer, that are causing heart disease, that are causing autoimmune illness. And again, working with qualified MDs and other healthcare professionals, and working with them on some other nutritional aspects that can be helping. Like, for example, with some of Dr. Lockridge's patients, we're now finding out that cancer has an inflammatory component. MD Anderson down in Texas is actually doing some phenomenal work on inflammation in cancer. One of the simplest little things that people can do is take curcumin or turmeric, which is a phenomenal anti-inflammatory, and it's directed mostly at cancer. So sometimes just a little bit of a guide towards some better nutrition, some supplementation to work with their whatever it is, whether it's cancer or or something else, can go a long way. So it's interesting. It's again trying to bring that integrative approach into traditional healthcare, and then alternative. Again, the second part of my practice in terms of the nutrition part. And it's amazing what you can do when you integrate both of them, and how the outcomes of these patients are so much better.
So on the nutrition aspect, then, can somebody just schedule an appointment with you to go over nutrition?
Yeah, it depends. Yeah, no, absolutely. I mean, they can schedule an appointment. What we like them to do is fill out a fair amount of paperwork. It's all subjective. I mean, I'm not sticking needles in someone's arm and doing tests. I can get all that information from their primary or their oncologist. But there is a series of questionnaires that I like them to fill out. It's subjective, but you know your body better than anybody else, right? So if you fill out a questionnaire, you know what's going on. Based on the results of that, and based on what their goals are, and based on whether it's, again, cancer, fibromyalgia, autoimmune illness, gastrointestinal problems, diabetes, whatever it is, we'll sit down and go over what their goals are, what's going on, and put them on a specific program. And it could be a program based on diet, lifestyle, in terms of are they getting the right exercise, are they doing what they should be doing in their personal life, looking at stress, looking at a bunch of different things, and trying, again, working with their primary or their oncologist to give them the best outcome, along with their chemo or their radiation or whatever their doctor is prescribing, and working with a little bit of the more alternative nutrition to have a synergistic effect, meaning that in synergy, 1 + 1 is not 2, 1 + 1 is 3. So if you do this and this, you get 3 times the effect, which is obviously a better outcome for the patient. So it all depends on what we're working with, who the patient is, what the cancer is, what their treatment is, and then we'll sit down and kind of work with what I would recommend. But I will always check with their primary or their oncologist to make sure that we're not doing anything that's going to harm that.
But how about like me? I'm healthy. I do have a little bit of blood pressure medicine and a little bit for cholesterol.
Okay.
And I feel great overall. But can I schedule an appointment with you to make sure that, from a nutrition perspective, that I continue that course?
Sure, and it's the two things you brought up: high blood pressure. One of the things that they're actually finding out now that has a tremendous amount of effect on high blood pressure, natural, is a substance called arginine. It's an amino acid. It's found in your body, and it's there. But our arginine has a little bit of a vasodilation effect. So some people who have very mild to moderate high blood pressure can just take arginine, and their blood pressure will come back down to normal, and maybe they won't need, or you won't need, the high blood pressure medication. Cholesterol, obviously, statins. That's what people want to. Most MDs want to put people on statins for high cholesterol. Red rice yeast is a phenomenal way of kind of controlling high cholesterol. Again, mild to moderate, and I'm not talking about at the end of the spectrum, but there are people who respond very, very well to the red rice yeast to get them down to a much normal cholesterol, lowering their total cholesterol but increasing their HDLs. So maybe if you can't get them off the whole medication, maybe you can at least cut down the milligrams. You can take lesser amounts so you have lesser side effects. So yeah, if you come to me and say, gee, I have high cholesterol, I have high blood pressure, I have this, again, that's something we could look at, then I would make some suggestions either through diet, lifestyle, supplements, and then we would go through that. I would very much encourage you to talk to your primary about this, and if he or she agrees that that's something that we can try, then we would work with it, and then I would monitor you to make sure that this is what's going on and we're getting the positive effects that
so you actually see yourself as a member of a team. You don't, when it comes to the other doctors, you're just
integrative. Absolutely. I know there's a lot of healthcare professionals that just kind of want to have their own little isolated office and not work with anyone else, and they're rare, but there are some people who are like that. I definitely like again, that's why I named my company Integrative, because again, if you don't have an integrative approach to healthcare and utilize all the exceptional talent in this area, in terms of providing the best quality of healthcare for the patient, we're completely missing the boat.
I know we've both met another newcomer to the area is Sabine Anderson, who is a midwife, and she delivers babies in the home, and I know she's having because getting your name out around here is tough because but I think she's arrived here at a good time too, because a lot of people think we Vermonters, especially Northeast Kingdom people, are behind times, when it's so funny. A lot of things that some people are coming here to revert to, well, they think they're moving ahead when they're actually catching up with us. And I think somebody like her, after her name is out there, I think she's going to do quite well, because I think there are those people now who appreciate childbirth more of a naturalistic.
Right. She will do well, I think, for several reasons, but two of the reasons: number one, she's incredibly competent. All right, so I think her competency, number one, is she'll do very, very well. Number two, the time that she was in my office and I was speaking with her, you can just see she has a compassion for her clients and her patients. And again, unfortunately, sometimes that compassion gets lost, when you are doing this for so long, and you just get tired of it, and that you just kind of go through it. It becomes rote. And I'm not saying that happens a lot, but it does happen sometimes. But when I met her, like I said, you could tell that she was, number one, very competent, and number two, very compassionate, and number three, committed. And I think you're right. I think she's up here at the right time, and she'll do very, very well. Now, getting some of the other healthcare providers up here to accept that type of healthcare may be a little bit challenging. But if she sticks with it and she gets her name out there and her reputation grows and her patients go to their primary care physicians and start talking about them and the good experiences that they've had, they'll be able to kind of maybe sway their opinion a little bit, and one by one, maybe they'll start.
And because I do know there's people from here, from Orleans County, who go all the way down to, I believe it's Littleton, because there's a midwife there. But I really do. I think we're at an exciting time here in the Northeast Kingdom in so many different ways. But I love seeing people like you arrive on the scene to join our other people. Then Sabine, and I don't know if she told you. I kept calling her Sybil's, and she finally said no, it's Sabine. It's the French version, and. it just seems like there's everybody's looking for brick and mortar changes, which is going to be nice, but I see there's more subtle changes going on. It's like when I was growing up here, now that we're in our 50s, it's always we talk about the past.
Yep.
Everybody had a garden, which comes on the healthcare stuff, and then during the 80s and 90s, the big spending time, those gardens became lawns. Now there's a lot more people. Suddenly those gardens are popping back up, and a lot of the newcomers, they fancy themselves as farmers because they have a garden.
A garden,
That's fine though.
No, it is, and again, a lot of people come in and it's amazing what they grow. Again, coming from Chicago, we probably grew a little patch on the porch. We had maybe one tomato plant. We thought that was a great thing. And here just to see what people grow in their gardens and whether it's organic or not. Anything that's obviously homegrown fresh is obviously going to be better for you. And it's amazing how many people come in and they always are talking about their gardens and what they're growing and the freshness. And one of the things I love, because once the season gets going, they're always bringing me in.
Yeah,
and
zucchini.
Things.
I bet you get plenty of zucchinis.
Yeah,
and cucumbers.
Yeah, I don't know. I don't know what to do with the zucchinis that I got. They were starting to piling up
Well, you can make bread out of them.
I don't cook.
Oh.
I'm a typical bachelor. I've been single most of my life, so cooking is not my forte. I would much rather have someone cook for me or go out to eat. And again, that may be kind of an urban thing. That it was always what are we eating out or what are we ordering out type of thing. And here it's changed because so many people here are just fantastic cook. Like I'm going to someone's house tonight who's making me a great meal, and I appreciate that very, very much because again, I cannot cook. I'm really bad at it. So.
Dr. Amanti, the guy who is 94 now, he talks about he'd go to somebody's house, and if they were really poor and he could see they were poor, they would he said, just what do you got in your garden?
Pottery.
And he said even if they didn't have anything, I think he even said he brought home chicken more than once, and
sure, absolutely,
and so on. But
and I have that, and again, I accept all insurances. I know there's some people who don't like to take Medicare and Medicaid.
Right.
In this area, but I take Medicare, Medicaid, all the insurances. We do all the billing because again, if someone is sick, whether I'm dealing with someone with cancer, who's a little bit more sick than someone who has some low back pain with some sciatica, the last thing they want to do is start dealing with all the paperwork. So we take care of all the paperwork and make it as easy for them as we possibly can.
Now, this is a little off the topic, but you can't. I can't have you on without asking you then is how do you get through the paperwork nightmare? Because I'm friends with Dr. Lockridge, and I know Dr. Wood really well. He and his wife run their office, and I know the mountain of paperwork. Do you get that same paperwork?
I don't get as much because again we're not dealing with a lot of the pharmaceuticals and the drugs and everything. But yeah, I definitely get my share of paperwork, especially as it relates to insurance. And I can take care of a lot of that, if it's really easy and if it works out, and I can just go boom, 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 done. But thank God I have a phenomenal woman who comes in 2 days a week at the end of the month, and by the time she gets in here, the pile is like this. But tomorrow afternoon when she leaves, the pile will be like this. So I just kind of put it there, and she's incredibly competent. She's very good, and she kind of gets through all the insurances, telling me this is what you need to do. You need to call this. You need to do this. So yeah, so she helps me tremendously. Could I do it all myself? Absolutely not.
Right.
So.
Now, where is your office located?
The easiest way, that's one of the reasons when Doug Spates rented me this, he goes, it's probably the easiest thing you can do. Again, not being from here, right across the street from the pick and shovel. I mean, how easy can you get, right?
Oh, so you, or even better yet, if you want to talk to local people, well, that used to be the old dairy.
Yeah, the old Hood building, I think they called it.
Yeah, the old dairy. Then it used to be a dance hall for a while.
Oh, it did?
Yes, it did. So, so you got a little bit of everything, and then you got the furniture store over there, and
Yeah, I don't know if that's still in business.
oh,
And I don't want to say anything that may be not
Right.
true, but so let's just kind of. But I thought there was something going on there. But no, as far as the location, it's great. You know, it's right there, right across from Pick and Shovel, right at the downtown area. And I don't know how much time we have left, but one of the things that I used to do a lot in Chicago is a lot of public speaking. Because to me, when you get out there and you get in front of people and they see you and they can ask questions and it's interactive, not only do they get a lot more out of it, but I get a lot more out of it. So we're having a talk coming up on March 19th at the Goodrich Library in Newport from 6 to 8. And we're talking about weight loss. And a lot of people think that weight loss is basically just a matter of calories in, calories out, right? Decrease your calories coming in, increase your caloric expenditure, you know, exercise a little bit more, and that should do everything. And that's just not what's happening at this point. There's a lot of other things in terms of weight loss that you need to take into account. One is the toxicity in our environment, which has a tremendous role of affecting brain chemistry, affecting thyroid, affecting different other organ systems. Inflammation can actually, you know, lead to tremendous weight gain. Lots of misconceptions as far as how to lose weight. Some of the different things you see out there, and they read in magazine, and like, oh, we're going to try this diet or this diet. Well, if they were perfect diets, they wouldn't work, right? So there's a lot more out there. So this talk is going to start with more the scientific basis of what weight loss is, and then give some really good points of how to maintain muscle tissue. Because when a lot of people lose weight, they think, oh, I lost weight. But if you lose muscle tissue as you're losing weight, you're ending up in, unhealthier than when you began the weight loss program. So we're going to look at how to lose fat, how to maintain muscle tissue, how to maintain energy, based on more of the scientific approach, other than just, you know, cutting down on some of your calories. So hopefully it'll be an interesting talk. So we're doing that on March 19th.
So you must look at some of these gimmick, well, I call them the gimmicks to lose weight, where
they are gimmicks.
And you're only but some of these, oh, you take this pill, only eat 500 calories, and like, wait a minute here, did you lose weight because of that pill, or only eating 500 calories? Mm-hmm. And then I've talked to people, they've lost weight, then you say, hey, they look really great. Then a year later,
it's back on.
Back on.
Because they've lost, some of that weight they lost has been muscle tissue, and muscle tissue is what's metabolically active. So if you lose 20 pounds, and 10 to 15 pounds of that is muscle tissue, now your metabolism has slowed down, you're not burning enough, you know, as much calories, so that weight over the next 6 months or a year is going to come right back on, because your metabolism is now slower than when you began, because instead of losing fat tissue, you lost muscle tissue. So in terms of weight loss, you have to monitor the type of weight you lose too. It can't just be weight, it has to be the right type of weight. And so, you know, we monitor all that too in terms of weight loss, and again, look at other aspects of losing weight other than just calories, you know, which is only one part.
I think community outreach like you're doing is a great thing, because I think we're a people like when I did PR, medical PR, I used to tell the stories of the people, you know, like put a face to some of these issues, and people really like that, because they can then feel like, you know, they can understand when they hear it coming from somebody. So so I think your things, you doing that outreach is going to be great. Now you have to get your word out there and get people there.
Yeah, and we're doing some marketing. Hopefully we'll get a better reputation. I mean, the first one we're going to do. 2 weeks later, we're doing one on fibromyalgia. 2 weeks after that, we're doing it on cancer. If those go well, we'll do another series of 3 talks on nutrition and chronic systemic illnesses, and how nutrition, lifestyle, diet, environment can all have an effect on this. So we'll see how things go.
You know what you ought to think about down the road is, some of you independent practitioners ought to team up and have like a, you know, like have not a forum so much, but set up at the Goodrich and invite people and have a series of speakers.
I think that would be great.
Yeah, 'cause,
You know, like you have Dr. Lockridge do a 40-minute talk on cancer.
Right.
They take a little break. Then you have maybe someone else do a talk
Yeah,
on.
Sabille on
Sure.
being a midwife.
Yep, I think that would be a great, and that's something that we can talk to
Right.
some people about. So
Yeah, no, I think that'd be a good idea. I think men particularly, um, women typically, as people say, they go to doctors more often. If you're for childbirth stuff and everything.
Mm-hmm.
But men, you have to bring us kicking in. Like I turned 50, and in the medical world, what 50 means.
everything's downhill from there.
Yeah, well,
which is totally not true.
No. I mean, like you get tests. It's time for the colon screening. Oh yeah,
Oh, yeah.
those are everything. Everybody, hey, look forward to those.
Yep.
But
Not really, but
yeah.
they're actually not that bad. But you're absolutely right when you look at the sexist part of healthcare.
Right.
Typically, women tend to take better care of themselves.
Sure.
They tend to listen more. They tend to go and seek out advice, and they tend to listen to that advice. So women are very, very different when it comes to healthcare. Men have the attitude, kind of like driving. I can do it myself. I don't need anyone telling me what to do. It's really not that bad. So there's definitely is a kind of a sexist difference between the two in how men approach healthcare and women approach healthcare.
But we also whine more, I think.
Oh, I think absolutely.
And I will say
So-
this: we can deny it all we want. The women are the stronger sex.
I agree.
Is no ifs, ands, or buts.
I would absolutely. After 30 plus years of treating, believe me, women are definitely the stronger
Yeah.
sex. And when you talk about when you talk about, you're referring to chronological age versus biological age. Okay, so biological age is how healthy your cells are, how healthy your tissues are. Chronological age is based on your birthday, your date of birth, and the two are pretty much never equal. So I could have someone come into my office who is 55 chronologically, but biologically they could be 30, and they can be in such great shape, or they could be 80. They could be in such bad shape. So I could have someone 80 whose chronological age is 80, but they're in such good shape that they're 50. So you're right. So there's a difference between biological aging and chronological aging, and very rarely are the two equal.
See, mentally, we talked about biologically and everything, but mentally, I think I'm 25.
No, we
but
all do,
then
yeah.
then I watch my show and I think, who's that bald middle-aged guy sitting in my chair?
Yeah, I do the same thing. I see a picture of myself. I'm like, really? What happened in the last 30 years? My hair is receding. It's getting gray. All these things are starting to change. I'm like, I don't look like this last time I looked in the mirror. But the way I look at it is like, as long as the years keep coming and the birthdays keep coming, and you're healthy and you're happy, it's a whole lot better than what the alternative
I
is.
wake up every morning and I can't wait to go to work. I love doing what I do. I love life. But if I were to die today, I wouldn't be necessarily very pleased about it. I could say, hey, it's been a great ride.
Yeah.
All right, how can somebody contact you?
Well, the phone number is very, very easy, 802-334-3000. It's probably the easiest way to contact me. Now, I'd be a little patient because, again, I'm not one of these chiropractors or healthcare professionals that are very aggressive, so I have a very small practice. And so you may have to leave a message because I don't have a receptionist, but I will get back to you. Website, www.drdonharris.com. You can go through all of that and look at all the different things that we kind of talked about today in my philosophy and background. That's probably about the easiest. Phone number and website are probably the easiest.
Right.
So.
Right. Okay. Well, thanks for coming on.
It's been a pleasure. Thank you very much.
If nutrition gives you the energy you have, I think you ought to. You certainly have to market that because you certainly have a lot of energy and a lot of enthusiasm.
It's a passion, without a doubt. I love the chiropractic part of it, and 50-50. But nutrition is definitely a big part of my practice. And chiropractic is doing very, very well right now, and I love doing it. and it's time to kind of maybe promote the nutrition just
Okay.
a little bit more.
Well,
So,
you'll have to come back on the show, and then maybe next time we'll pinpoint some things. And this was kind of a free-flowing show, and maybe
no.
next time we'll come on and focus a little more on nutrition.
whenever you want to have me back, just let me know. I'd be happy to.
Okay. All right. Thank
cool.
you.
Thank you.
And thank you to the viewers for tuning in to another segment of the Northeast Kingdom Voice.